Okay, well, um, I figured we could go ahead and get started. Today's is just a community conversation, so if there's conversation, great. And if we kind of get to a point where we've talked it out a bunch, then you can get a little bit of your hour back. But for those who don't know me, my name is Rachel Mark. Welcome to Primary Care Behavioral Health Special Interest Group meeting. I am one of the co-chairs of the group. And we have one of our new members on here, Khadijah. I don't want to put you on the spot. Would you like to introduce yourself?
Um, sure. My name is Khadijah. Like Rachel said, I'm very, very new here. Just trying to get the hang of things and lay of the land, but I'll be writing a student corner in the newsletter. So you'll probably see me on a lot of these meetings as I, just begin to have a better idea of the way that things are going so that I can have some interesting information to contribute. So I'm just hanging out.
Yes, we're really glad to have you. Some of our other leadership members couldn't be here today. And so hopefully you'll get to meet them in the newsletter when it comes out next week. But I am the other members of our team. We have Dr. Desiree Rivers, who is our other co-chair. We have Ryan, who is our early career representative. We have Dr. Faust and Dr. Grant, who were on the team from last year. And so, yes, thank you for being here today. We'll do some announcements, kind of similar to how we did it last year, but if there's any job announcements, training announcements, any opportunities that you would like to share with the special interest group, feel free to jump in and share those. And we also have the job board on the CFHA website. But any new opportunities that anyone would like to share today? Okay, well, if you remember later or want to jump in later, that's okay too. But if you don't mind going to the next slide, Hannah, perfect. We are going to continue our mentoring program. During the transition, it's been a little bit we just haven't been able to pay as much attention to it, but we're hoping to get that back up and going soon. And so if you would like to mentor, I'll have you scan with your phone the QR code on the right. And if you need a mentor, feel free to scan the one on the left. Myself and our new early career representative, Ryan, are going to be looking at those entries and matching people up so that if there is an opportunity for mentoring, we can make that happen. And we would love to hear your feedback. We want to make sure that this is a space where you feel like the things that we discuss are relevant and helpful. And if you have something that you would like to teach on or share in one of these meetings, please let us know. You can let us know through this QR code. You can let us know by reaching out to any of us. But we love feedback. We value feedback, and we take it earnestly when we get it. It's important to know that what we're putting out is helpful for people. Okay, so those were the intros, the announcements. Today's topic is going to be kind of centered around artificial intelligence in primary care behavioral health. And we labeled this as a community conversation because we're curious. What does using AI and PCBH look like? Is anyone using it in their clinics? Are there ways we need to be kind of on guard or watch for in terms of ethics, patient protection? Are there ways that this could be a barrier for care or could help progress care for people? And so I'd like to open it up. Is there anyone here today that their clinic is using AI right now in the primary care setting or considering it? Have there been any conversations about it there?
My organization I just recently joined this past summer. We talked about it. I've actually spoken. Um, I'm a clinician, but I have a sales background, and I was actually interviewing for a company that's an AI note-taking system for clinicians. And I got the whole rundown on what the software does and advocated that at my current organization. I definitely see the value there. I think, I don't know about you guys, but my organization is kind of not looking to make investments where it's not absolutely necessary. So it wasn't a priority, even though every clinician I've spoken to thinks at least AI in terms of the note taking, progress note completion piece, or recording so that the note is automatically created, was definitely an interest among my peers. And I would love if it was implemented in my workplace, but it has only been initially discussed.
Okay. And do you mind telling us a little bit about like what you learned from listening to that, or like kind of some of the aspects of what it would look like?
Yeah, so it was called, the company called,
It's okay if you can't remember that part.
I'm totally blanking, but essentially the software was integrated with the EMR, and only the clinicians had access, but it would record similar to, like, if you guys ever heard of Gong, which is a call recording tool that pulls out keywords and then will summarize the call for you and then give you a synopsis. So the tool would record, it would pull out key terms, it would create a progress note based on a identified format that you wanted, like a SOAP format, if that's what you're looking for, and then give you a chance to go back and edit it. But yeah, that's kind of the crux of it. And then the patient themselves has to consent to the recording happening in the first place. I haven't had a chance to use it myself, but I've got the demo. Oh, I remember what it's called. It's called Elios, ELEOS.
So it sounds like that would be kind of centered on the note taking aspect of it. So it would kind of make that go a little bit quicker, which that
Exactly.
does
Yeah.
sound very nice, very helpful.
Yeah, for sure.
I'll pop on. I am the office that I'm working for has DAX, which was rolled out for the pediatricians in the office, the medical providers, and then they're recently expanded into more of the psychiatry option, actually. And so DAX, it sounds like it's similar to Elios, where it like records the conversation and is integrated with Epic, and has it kind of creates a summary of the conversation for the notes.
And have you personally been able to use this?
Yeah, I've been using it for a few months now.
Okay. And what is your take on it? Like, what feedback do you have about using it?
I think there are definitely positives and negatives to it. It often will streamline my note writing, which is very nice. It provides, a really nice kind of scribe option, basically. It's not always accurate, and it definitely comes from more of a medical background versus psychology, mental health sort of background. And so I have to kind of change around some of the content in it. Another complaint that I have is that it's through Dragon, and the company itself it's not very forthcoming with information on what it does with the recordings. It does keep them, and it is HIPAA compliant, but I would imagine that it's probably serving a foundation for further AI products, kind of like further computer learning off of the data that it's collecting. But it's not clear, kind of where that might be headed. on their website.
Thanks for sharing that. I could see how that, not knowing exactly what's happening with this information, especially, you know, as a provider, but then when you think on the patient side, like they're consenting to this and we can give as much informed consent as possible, but we can't give total information about what's going on. Has anyone else had experience with this in their own clinics, whether on the medical side or the behavioral health side? I think Megan brought up a good point about kind of some of the ethics on using AI in behavioral health, because we know patient confidentiality is of utmost importance. And so I wonder if anyone has thought about it, whether just on a personal level or for your own clinics, like what concerns or what barriers do you think there might be in using this in these settings?
From a clinician perspective, I definitely wonder how it might influence the therapeutic relationship. Just from experience having like a supervisor or a training intern sit in on a session, the patient, you know, obviously okays it, but the experience is different. And so maybe knowing that you're either being recorded or AI is involved somehow, wondering how that might influence what ends up being in your record. And then the fact that it's not coming from our own words, so that if a patient does request their records and sees something in there that feels off-putting, because I know personally for me, like I'm very careful with wording, because if things get subpoenaed or if a client wants to see their record, I want it to be you know, as accurate as possible from my own words. And AI is great for some things, but I could see myself, if I used it, still needing to go back and edit just some of the phrasing and word choice for certain things. So I would hate to see patients feel a little bit of unease, because the benefit feels like it goes more towards the clinician in that case. When I'm thinking about the note-taking piece of AI.
Right. Sounds like from where it's been rolled out, or people have considered it, it's you can edit it, but then to some extent, it's like, how much editing am I going to have to do so that it sounds like the way I usually take notes and what the patient may have seen in their notes prior to using it.
I think one edit that I often have to make when I'm using this, especially on the behavioral health side, is that the AI system that we're using will just say like, here are statements. And sometimes it almost puts it as a phrase of like, here's what my, you know, interpretation of this is, rather than saying like patient reported this or things like that. So patient reported that they think they have borderline personality disorder would be much better than patient has borderline personality disorder, but it doesn't, it kind of jumps to conclusions sometimes. And I think one of the concerns is that it just kind of spits out all of this information in your note, and we have to go and read through it all and make edits and things like that. And us being human, we're going to miss things sometimes. And so I do end up having to be quite diligent and having to delete a lot of information that it includes.
I mean, that's a good point, right? Like, you're like, okay, my note is mostly done and I know I need to edit it, but if you've seen back-to-back patients and you're trying to keep work-life boundaries and there's only so much you can edit in that time, like there may be the concern of missing, you know, the statements, like you said, like it just jumps to conclusions when in reality it would have, the experience was much different than how it was charted. Do you find that, Megan, when you are having to do edits and when you're using it, do you feel like it has helped you save time in note writing, or do you feel like it kind of adds on like an extra piece since you're having to basically like read back through it?
I think I can almost kind of tell when it's come through, when updates have been pushed through, because like when an update is new, there are times where I notice that I'm having to do a lot more edits, and it takes more time. And then other times where it's like it's really simple and it totally speeds up my note writing process. And
Mhm.
so it's kind of 50-50.
Okay. And you may or may not know this, but does it have like some sort of algorithm that kind of learns your style, or is it kind of the same in your
Um,
experience?
the one that we're using, it has a couple options for how it organizes information, but it's like system wide. And so
Hmm.
it doesn't learn specifically from me.
Okay. Okay. Interesting.
I think another ethical component that I'm keeping an eye on is again what they're doing with this data. And so there's been a lot of like on the behavioral health side, right? Like there's been a lot of attempts to create an AI behavioral health provider. So like
Mhm.
Tessabot was a one that was in the news quite a bit, where it kind of was an AI system that was rolled out for an eating disorder hotline, and it was just a total mess. Like absolutely saying the wrong things to people calling into the hotline, like really unethical sort of rollouts and things like that. And that was like a really bad example, but I do wonder about like, they're collecting data through the health care system now. They have access to medical records that were kind of like, connecting these recordings to. And so they have, companies have the potential of having a lot of data that they might be training new AI systems off of. And uh, I'm wary about, kind of where that will go as well, as far as, kind of certainly job security is one concern that I have, but then also like the ethics of rolling out AI systems that may or may not be uh, appropriate.
Sure. And I wondered too, as you were talking, I was thinking, like our patients have a right to their notes because it's their information. And so then I wonder, like, do they have a right to those recordings? Like who technically owns it? Like the companies or does the patient? You know what I mean? Like where is the kind of the line on whose is it?
With the system that I'm using, like it does have a transcript of the recording, but it's so odd because the transcript is terrible.
Oh,
It does not match the conversation very much at all, which is another concern legally because,
mhm.
if the transcript is just like totally garbled, like makes no sense at all, does not fit the conversation, um, and does not match even like what the AI generates as a summary, um, it's uh potentially a question about like if something is in the transcript but not in the note, if that was subpoenaed or something like that. And that's the part that makes me a little bit uh I think, I'm trying this out, but I'm also really wary about the legal consequences of it because it's such a new field. Um, and so yeah, I have growing misgivings about it, I suppose.
Mhm. Like what protections are in place if this transcript is pulled and you as the clinician and the person that was there knowing what happened, but then them having this as a like a documented medical record.
I think at this point, the transcript is so garbled that it doesn't make any sense at all. And so like there is, some protection from that piece of like it's obviously not accurate.
Mhm.
Um, but as things change, if yeah, if that might change as well.
Mhm. Did you receive training before it was implemented?
No, I work for a broader health system, and so they like have a lot of like kind of transcripts and or not transcripts, but like flyers and advice and kind of walkthroughs, but no specific training.
I just posted something in the chat, but I listened to a lot of NPR and there was an interesting story about AI therapy, or relationships. And some of the study, most every study that's been done, people report that it does make them feel a relief of their loneliness, their stress, some of their anxiety. And the article and the experts on the program were talking about, like, does it matter? Like, if someone feels better, does it matter if that intimacy is artificial? Whether it's a therapeutic level of, you know, intimacy in a sense, or a friendship intimacy. And it is really interesting that there are some positive outcomes for people, but a lot of my thoughts are, we're already so disconnected and technology is so easy and so addictive that we might lose our ability to connect to real people in real time. And there's something about that intangible essence of a real human. But then again, maybe for short-term uses, like if someone's insurance drops and they can't afford care, like where's the balance there to maybe recommend a tool like that in the interim? So interesting to think about.
That is interesting.
Yeah,
Especially-
I've heard of,
Go ahead, sorry.
I'm sorry, go ahead. I was just going to say, I've heard of people using AI for therapy because they don't have the like financial means to get therapy, and like where their insurance has lapsed. And on one hand, it's like, if you can get that and it's helpful, then that's good. But on the other hand, AI is just as subject to like human like biases of the creators of that AI to some extent. So it's like, is that something that we can limit, and to try to reduce any harm that might come from it? And like, if we could, how could we do that? And I don't know the answer, but just an interesting conundrum.
Almost like if we could train the AI to recommend to the person. I mean, they have a listing of providers in the area that they, like, after a certain amount of time talking to them, that they could recommend. Even like the text-based stuff like crisis text line, at least that's a real human and they're trained. Because one thing I heard about the chat therapists is that they over agree with you. Like, they're less likely to challenge you. They know how to make you feel good, that's for sure. Because they learn what makes you feel good, but you're not necessarily achieving sustainable or meaningful change for yourself. So yeah, lots to
Sure.
think about.
Yeah. The idea of like, it has some sort of algorithm where it learns you and kind of learns what you want to hear maybe, and not necessarily what you need to hear, which I think is part of what maybe Dr. Rivers was touching on, of like, you miss the human aspect of the counseling, and it sounds like in some ways the chat bots or whatever you want to call them, they have a bias towards you. Not that regular, humans have biases against, but we practice being unbiased in those settings, and having, sometimes to say the hard thing because we know that it's something the patient may need to hear. And we've built that rapport with them, not by saying yes all the time, but by being a safe person.
I'd be curious to hear, just, I don't know if we did this before I hopped on, but where everyone is based out of and in what settings everyone is working. I'm in Massachusetts.
That's a great idea. I'm based out of Tennessee, and I'm a behavioral health consultant in a primary care and midwifery, FQHC.
I am in Arkansas. I'm a behavioral health care manager for the primary care clinic at UAMS.
I'm in North Carolina, but my practice is in Washington, D.C., and I am a behavioral care manager for a company called Era Supports, and we contract with FQHCs in that area.
I'm from Kansas. I'm a behavioral health consultant in a clinic and an FQHC as well.
I am located in
I think you might be muted.
sorry about that.
That's okay.
Hello, I'm based in Austin, Texas. Previously with the FQ, doing PCBH for numerous years. Just recently actually, because of some personal stuff and decisions. Anyways, I started with a new company virtually. It's all virtual care for primary care. It's called Ovation. They're based out of Cleveland with some partnerships in Cleveland, Ohio, and soon to be South Carolina. And so our CEO just wrote a blog after attending a conference, but AI has kind of been a conversation that's been brought up. I haven't seen it implemented here, but it looks like that's something that that they're looking at from my understanding now. Hopefully I'm understanding correctly. But it's all virtual care, so we're not technically doing PCBH at this moment, but it's integrative behavioral health, implementing a lot of similar um, ideas, right, with warm handoffs and things like that. So yeah, this conversation is interesting. The time is interesting because I'm starting this new role, and so to see how I'm just interested to see how AI influences primary care, and then also influences behavioral health. I think it may have an impact. I think somebody mentioned about Epic and DAX, and we saw that at the primary care that I was at before. I didn't use it, but a few other behavioral health providers were using it, and that was just by decision. I like to write my notes. So anyways, so yeah, Austin, Texas. Long story short, but worked virtually for a virtual primary care clinic.
Cool. Awesome.
And I know Megan was sharing about use of AI, and I kind of popped in because I had a patient. But does anyone else use AI in their roles? I don't, except like sometimes in meetings we use like AI to take notes. But I'm just curious if other people are using it in other ways.
Not right now. I use it, yeah, to take notes like on calls like this, like internal team calls. That's the extent.
Yeah, I haven't been using it in my practice, but I noticed using ChatGPT a bit more and more like admin things. Um, and so I'll search in like PCBH or what behavioral health consultants and see what kind of ChatGPT says, and based off of that, might be able to help me kind of generate some ideas or structuring um, like presentations, things like that.
That is a good for anyone who uses ChatGPT, whether in personal use or if you use it to just like kind of generate ideas, like what does that look like for each of you? Like, is there a place in your job or your position where you do use ChatGPT, maybe not for patient-centered things, but maybe some other aspects of your roles? I use it to create handouts for some of my patients on specific things. Like if I don't like what I see on the internet basically, or maybe there's something from this I want, something from this I want. I've used it to create like handouts about like the DASH diet or managing your diabetes or something like that.
Hi, everyone. I joined late because I was in a grant meeting, sorry. But I was really fascinated by this, and I'm sorry I missed the first half because I have an interest in like the mental health part of it. But we do that over here. I'm in Ventura, California, oversees behavioral health of our health system, 2 hospitals and multiple clinics. So I write a lot of grants. So I
Mhm.
actually use ChatGPT a lot just to write grants. So you pop in, or you need data. If I'm looking for hard data, I'll pop it in. But also for all of those things for my staff, when they're like, I need something on behavioral health with, depression or diabetes or sleep, I'm like, just pop it in there quickly. If there's not another website to go to, they can just pull off information. But it's also, you have to kind of work with it too, because it doesn't always sound right, and you have to make it your own. So I think that's also really important. Like, it really does. If I'm doing a grant, I have to make it my own. If I'm trying to tell the story of a narrative, or I'm speaking at a presentation, I try to, like, I have a real life situation, and I'll put it in there like a scenario, and I'll say shorten it or make it better, or or I'll ask them, create a scenario with an elderly patient who has diabetes and depression, and create a short scenario, because I'm going to go do an interview and I want somebody to pull that. So I've used it on every which way possible, because it really does help. I didn't know if anyone was using something other than ChatGPT.
We had someone in here earlier who had to pop off to go see a patient, but they were using, I can't remember what they said it was called, but basically AI to help transcribe the conversation and help them type their notes. And they were saying that they have to, sometimes the program will put things in statements. So instead of saying patient reported feeling this way and they think that they have this, it'll say patient has this. And so they were saying they have to kind of go back and go through and make sure it's documented in a way that's helpful and accurate. And they also said the transcripts kind of are a bit garbled, like they just don't make sense, but they end up being part of the note or the record because it's through the program.
Interesting. Well, is anyone here on Epic?
We
No?
use Valent. I know a lot of people use Epic.
Yeah. Well, we're transitioning to Epic. That's my point, is they say that they're going to help more AIs. Like, does anyone know about this? Yeah, we're not at Epic yet, but in 2 months we are. So.
Okay.
Yeah, Epic's great. And I appreciate y'all sharing and having a little bit of the conversation with ChatGPT, because I think that's what I'm noticing, using it a lot more. And Rachel, you mentioned, using it in terms of like maybe how to like give a handout, right? That's a little bit better, easier, maybe structure or read for the patient, right? I like that. Yeah, I haven't used it in that sense, but I mean, that kind of sparks maybe some ideas in terms of like how to use it in that way to be a little bit more efficient with sending stuff. Like, it's because we use Epic, so you can send a lot of stuff through the My Chart, and kind of creating those handouts. But yeah, I think for me in the past, I was in my last job, I was like in a little bit more of a supervisor role. So it's like I used it to help kind of figure out, okay, how do I create a checklist for PCBH, like with onboarding stuff, right? It's a lot more like admin related stuff, like, okay, like onboarding stuff, okay. Maybe like ideas for presentations to how to like, different ideas to introduce it to the teams and things like that. So and I just kind of, I don't use it a lot personally, but professionally I notice a little bit more. Just to get, I think somebody mentioned just like get some ideas. Like I'm like, oh, what's Chat GPT say about this? And let's see what it pops up. And then just kind of use that. And actually that it saved me a lot of time with like trying to think about it myself and get it like from a basic idea. I could use that and pull, similar to what I think Maureen was saying about like making it your own, but like having that kind of structure already there, that saves me a lot of time. So
yeah, like adding context so it knows the approach you want to take to whatever the outcome is, or you like your style of how you would speak or explain something. Because I don't know if you all have experienced this, but if like you get submissions from people and you read through them, sometimes you're like, I know where this one came from. I know what was written by a person, and sometimes I know what was written by AI. And so you kind of have to watch out for those things. Any other ways people have been using it, whether it's ChatGPT or some other program?
Sorry, I feel like I'm talking a lot more now, so I apologize.
Oh, you're good.
It just made me think because I literally just used it earlier because I was trying to. We're starting the warm handoff process here, and we talked about creating a survey to get some feedback from the medical providers. And so I was like, okay, I know what type of questions I'm going, but I was like, let me see what ChatGPT, and it came out with like 5 like structure like
Mhm.
questions with like with the different ratings, and I was like, oh, these questions aren't actually too far off. So I was like, maybe I could use this to build off and kind of make it my own. But yeah, that was an example. I used it earlier, like this morning, actually. So
Yeah, that's awesome. And I think too, when we think about this conversation, it's not just, with the patients or in our sessions, but also like just admin tasks. Like, are there ways that we can use it to improve efficiency so that we're able to put our energy towards what needs to have our energy?
I used it recently. I was thinking about ways, since I cover the whole state of Massachusetts, ways to get involved with school counselors to make them aware of our services. And just kind of said like, hey, how would you go about connecting with school counselors, superintendents around mental health services, and where do they congregate, like where, like something along those lines, like events and organizations. And I probably could have found that information just by Googling it, but it gave me like the Massachusetts School Counselors Association, and then like the links directly to where you can just search for every single email address for every school guidance counselor. And like I've had a lot of meetings from that, and just to make them aware of our services for their kids. That was helpful. And even like strategy ideas of like,
Yeah.
how would you approach this on a strategy for getting more awareness to schools, like in that bucket. And yeah, it's always helpful. It gets the ball rolling for me for sure.
Yeah, if nothing else. Like,
Yeah.
I have all these ideas, but I don't know where to start. Or like, I don't have any ideas and I really don't know where to start.
Mm-hmm. Yeah.
That's a really good idea. So some of our partners are switching to Epic, but right now we use this program called ECW, or they use that, and we kind of have like access to it. And they have like an AI program, and it's called like Eva, but it's not. I've never found ECW's interface to be super user friendly personally, but it's more for like administrative tasks. But it can also like check your incoming referrals and stuff like that. But I hadn't thought of like using it to jumpstart ideas, because we have a lot of very interesting patients, and I sometimes I could use some new ideas. So that's helpful. I'm gonna use that. I think I'm just like shell shocked from finishing like recently in grad school. They're like, there's all these talks about intellectual property and copying things and not using it for that reason, but I don't think that that's an issue like in practice if we're being ethical.
Yeah. I feel you. I just finished my MSW, and it was very much like just starting to hit like max capacity of people using it. But that's different in an academic setting when you're writing research papers.
Mm-hmm. Like
But
putting your name on it.
yeah, yeah.
um when you mentioned that ethical, it just maybe this is another presentation another day, right? But in terms of like ethics and how that relates to using AI, it just made me think in terms of like that part of it. And so but yeah, maybe I could look it up and see what's out there using ChatGPT. So
That would be interesting. Well, I know we have just a little bit of time left. So, any last thoughts about the idea of AI in primary care? Any opinions on, do we think this is helpful? Do we think it's something that we'll have to keep our eye on? Anything like that?
I have a kind of conflict relationship with AI or just technology. There's a part of me that does not like it. I just want to throw my phone away and all that, right? And then there's the other part, right, where we have to consider kind of where things are now and what direction it seems like it's going, right? Like I'm just reading stuff about like AI and primary, it's just in medical, right? Like it's something that's being talked about more, and so I guess maybe I'm looking at it, it's like there's hesitation and maybe a little bit of resistance to incorporate AI usage in my daily practice, but it's looking at also, it's like, okay, how, if it does get involved in primary care, which we are actively in primary care, right, doing primary care, then how do we utilize it in a way that's going to be helpful for patients, for us, for the medical team, right? I don't know what that looks like. It could be using part of it from time to time or what, but there's that part of me that's like, well, I mean, if I resist and try not to use it, am I gonna I'm just gonna fall behind, or everything like Epic and all EMR is gonna move towards that direction, so that's gonna be like the norm, right? So anyway, those are just thoughts I have because I'm mixed. I'm like, I don't know about this. I don't like it, but also like it's there, right? So so it's just kind of for me, just kind of okay, taking and pulling, okay, what's going to be helpful for me, what's going to be helpful for our patients, what's going to be helpful for our providers in the overall practice of primary care, right? And hopefully, yeah, it's I can learn to better utilize it.
And I think you're not alone in that sentiment of like, there's this hesitancy because we want to protect our patients and we want to like hold to our ethics. And then on the other hand, it's like, but it would be really nice if we could expedite some things so that we can focus on patient care as opposed to like spending so much time charting or whatever. But you're right, there's like this tension of like, this scares me a little bit, but also like, if it's going to be helpful, I might be willing to do it. So I think you're definitely not alone in that feeling. Well, awesome. Thank you all for being here. Thank you for this conversation today. I know it was kind of broad and grand, but I do really appreciate all of your feedback and participation. This session, if there's someone who wasn't able to make it, but wanted to see it, it's going to be recorded and posted. Our next meeting date is April 17th at the same time. Hannah, if you don't mind going back to the QR code for the survey, if there are things that you feel would be helpful for us to discuss in these meetings or something that you're kind of the expert on or would like to teach others about, please fill out the survey. There's an option in there for you to jot that down and give your ideas. And so if there's something you feel really passionate about or feel like would be helpful to discuss as a big group team, absolutely take the time for that. But thank you for being here. I'll stick on for just a few minutes in case anybody has questions or anything. But I hope you all have a great rest of your day, and thank you so much for your participation.
Thanks, Rachel. Thanks, everyone.
Thank you.
Thank you all. Bye.